Good afternoon, everyone. My name is Dr. Lori West, and I'm the scientific director of the Canadian Donation and Transplantation Research Program, and I'm a pediatric transplant cardiologist. We're very happy to have you join us for this session this afternoon entitled, "We've All Gone Through the Same Journey, Mindfulness-based Retreat for Mothers of Pediatric Heart Transplant Recipients." The description of this particular session, as you can tell from the title, from the time of diagnosis, mothers are significantly more likely than any other family member to be the primary caregiver of a child with a heart transplant. Given that a mother's ability to cope with the demands of caregiving predicts positive social and health outcomes for the child, it's critical that maternal coping and well-being are supported. This presentation will highlight results from a two-day mindfulness-based retreat attended by 16 mothers of pediatric heart transplant recipients as an innovative intervention to improve maternal coping, quality of life, distress tolerance, and reduce social isolation. Guided by the experiential expertise of Joanna Mitchell, who is one of our patient partners, this presentation will emphasize the importance of patient and family-centered care and the intersection of maternal well-being and child health outcomes within pediatric heart transplantation. And I'm very happy to say that the CDTRP, the Canadian Donation and Transplantation Research Program, was very happy to support this innovative event, this retreat. So our two speakers today are Dr. Samantha Anthony, who's a clinician health scientist at the Hospital for Sick Children Research Institute in Toronto. She's an associate professor of the University of Toronto, and she is one of our CDTRP investigators. As a clinician, Dr. Anthony works with the multidisciplinary transplant team and provides psychosocial assessment, interventions, and consultations. In her research role, she leads a clinical research program that's focused on establishing evidence-based foundations for successful psychosocial adaptation and enhanced quality of life for children with chronic disease, and a particular emphasis on pediatric organ transplantation. She's been recognized for her dedication to clinical practice, as well as the application of research into these clinical outcomes, these clinical scenarios for improved outcomes. Samantha will be followed by Joanna Mitchell, who, as I mentioned, is our patient partner on this study. Joanna is the mother to 17-year-old Riley, who received a heart transplant at 7 months of age. Soon after Riley's transplant, the Mitchell family became involved as volunteers with the Trillium Gift of Life Network to encourage others to consider organ donation by sharing Riley's story. As part of the Canadian Transplant Association, Joanna has helped organize a number of events to promote organ donation, as well as healthy living and active living after transplant. She's worked as a parent liaison to bring pediatric and family perspectives to the transplant games that are organized by the Canadian Transplant Association. She encourages connection of transplant families with each other by facilitating various social media groups and informal mentorship. And lastly, she's a patient caregiver partner with the CDTRP, particularly with a focus on projects related to pediatrics and the mental health of transplant patients, as well as their families as a whole. And so with that introduction, I'd like to ask Samantha, please, to start us going. Samantha.
So thank you very much for the warm introduction, and thank you for the opportunity to be part of this exciting educational opportunity. And I now have the pleasure of handing it over to Joanna to get us started.
Samantha. It was in 2005, at 2 months of age, that my daughter Riley was diagnosed with a heart condition called dilated cardiomyopathy. At 7 months of age, Riley received a heart transplant. Not only were my husband and I first-time parents, but we were also learning to care for a child that was going to need lifelong medical care. On the slide here, you can see Riley in the first picture on the left, and this was the morning before her transplant. And the second picture is of her today. She's about to graduate grade 12. And the picture that she's holding in her hands is 11 days after a transplant, and she was about to be discharged from the hospital. The first couple of years after Riley's transplant were very stressful for all of us, but for me particularly as her mom. I spent a lot of the first years not sleeping and crying often. When Riley slept, I was always checking on her to make sure that she was still breathing. The isolation that I felt was profound. While other mothers in the community were stressed about childhood vaccinations, I was worried about my child staying alive. And as the mother to a child who received a heart transplant, the caregiving, the worrying, the researching, the organizing of medications and appointments often fell to me more than any other family member. Through connecting with other transplant mothers and speaking to members of the research team, I soon learned that I was not alone in this experience. I was able to see that those moms who developed positive coping skills and developed relationships with other transplant mothers experienced better social and health outcomes, both for themselves and for their children. And those who did not would often experience symptoms related to post-traumatic stress disorder. Given that a mother's ability to successfully cope with the demands of her caregiving role predicts positive social and health outcomes for her child, it's critical that mother's coping is clinically assessed and supported. To support mothers, we designed a mindfulness-based retreat for mothers of pediatric heart transplant recipients to enhance maternal well-being and improve coping through mindfulness skill building and peer support. The retreat emerged specifically from patient and family identified needs and priorities. From the time of diagnosis, caring for a child with a heart condition is a source of persistent and chronic stress for families. Mothers are most often the primary caregivers for pediatric heart transplant recipients, and as such, mother's quality of life is impacted more than any other family member by the demands associated with transplantation. Mothers often experience high levels of social isolation and poor mental health outcomes. And previous research on maternal coping demonstrates clinically significant levels of psychosocial risk for poor mental health outcomes in 40% of respondents. This elevated psychosocial risk and emotional impact appears to be enduring as the high levels of risk remain several years post-transplant. Successful maternal coping is linked with positive outcomes in children, and adverse coping is linked with the development of PTSD in mothers. Untreated symptoms of PTSD can ripple through the family system and can directly impact a mother's caregiving capacity, which then impacts their child's health, well-being, and adjustment. By teaching mothers these positive coping skills through a retreat, they will benefit her not only as the caregiver, but also the child. And I know as a mother, this is something that I would have benefited greatly from. The retreat was designed to incorporate what we already know to be successful for improving coping, and was innovatively restructured to meet the needs of our heart transplant population. So the key targets of the retreat that were innovative included supporting caregiver needs. The retreat targets mothers as the most common primary caregivers in pediatric healthcare, and thus the population with the most need for timely support. Removing barriers to participation. The pilot design removes caregivers' number one indicated barrier for participation, which is the time commitment. Traditional mindfulness is facilitated often is group sessions, and they'll last several hours over 6 to 8 weeks, and there'll be additional daily homework components. But our pilot mindfulness-based intervention, it was designed as a retreat, so it offered an impactful intervention with a short time commitment. And the retreat taught mindfulness skills. The retreat will support the mental health needs of mothers through building competence in mindfulness skill building and coping skills through formal instruction. It also was promoting community building. The retreat reduced social isolation by providing an opportunity for geographically diverse mothers to connect and build community through shared experiences and peer support, reducing socialization. So all of these targets were then incorporated to form this innovative retreat-style intervention. And this all aligns with the child and family-centered care and recognizes that while the child or patient is the core of all that we do, the family is also central in the child's life.
So the objectives of this program of research were to determine the effectiveness of the retreat on maternal quality of life, distress tolerance, coping and perceived social support, and also to evaluate the implementation effectiveness of the retreat, including concepts such as acceptability, adoptability, appropriateness, feasibility, and fidelity. So as mentioned both by Lori and Joanna, the mindfulness retreat was a 2-day pilot retreat. Participants recruited from the Sick Kids Labatt Family Heart Center here in Toronto, and mothers were eligible if their child was a minimum of 4 months post-transplant, lived in Ontario, and spoke English. The retreat included mindfulness meditation, which involved active awareness of the mind to refocus on the present, and each meditation session built on the contents of the previous session. The retreat also included deep relaxation, which included self-care tools to guide participants to learn how to check in with and relax the body. The focus of these exercises was on stress management and relief. Lastly, the retreat also included circle sharing, in which participants participated in mindfulness sharing and listening in a safe and supportive environment. Skill integration was a focus, and the competencies developed in these practices were incorporated into other activities, such as meal times, which involved silent eating, yoga, and walking meditations. A mixed method design was selected to evaluate the retreat using both quantitative and qualitative measures. So quantitative data was collected using 5 questionnaires assessing participants' ability to be mindful, coping skills, perceived social support, distress tolerance, and quality of life. And questionnaires were administered and completed 24 hours before the retreat, immediately after the retreat, and 3 months following the retreat. Qualitative data was collected through focus groups and individual interviews. Focus groups were held on the last day of the retreat to understand participants' experiences at the retreat, and interviews were conducted 3 months following to explore adoption of the mindfulness skills and the impact of the retreat on their lives.
So we hosted the retreat in April of 2022, so exactly a year ago, at the beautiful Hidden Valley Resort in Huntsville, Ontario, Canada. There were a total of 16 mothers of pediatric heart transplant recipients that participated. The average age of the patients was 10 years old, and they ranged in age from 2 to 17 years old. And the average time post-transplant was 8 years, and the range was between 1 and 16 years. You can see in this picture, this was actually when we first arrived at the retreat, and it was a beautiful day, so we were able to take advantage of the weather and sit outside. And you can see that we're in a circle sharing. This gave us all a chance to get to know each other and share in a safe and supportive environment. And throughout the weekend, we learned different techniques for mindful meditation, and all of those activities built on the one before, so that we were learning as we were going and building on what we did for each activity. And in this first picture here, you can see the group is doing a deep relaxation exercise. It teaches everyone to check in with their body, and it's something that can be easily done at home, and you can do it within a matter of 5 minutes, or you can do it for longer. And in the other picture, we had the chance to sit around a fire and roast marshmallows the one evening, and that's where we continued to share our stories and bond together. Throughout the weekend, we enjoyed delicious vegetarian food, and we took the time to practice mindful eating, showing that just by taking a few minutes of time to focus on our food, we can also take that time to focus on our minds. We actually found this activity a little bit challenging because all of us mothers were just so excited to have the chance to be able to talk to other transplant mothers and share experiences with one another. So it's a good skill to have, but we did find that one probably the most challenging.
So from the focus groups and the interviews, 3 themes emerged reflective of participants' experiences during the retreat. So the first theme was respite. So the significance of being immersed in a retreat environment. There was an overall gratefulness from participants for the retreat, which was described as a reset and break from the physical and emotional demands of caring for a child with a transplant. Many shared how the ongoing care of their child felt overwhelming, leaving many mothers with not much time for themselves. This was particularly salient for mothers of younger patients or patients with more complex care needs. At the retreat, participants described how they were able to rest, relax, and recharge. For many, the retreat-style environment was not only time away from caregiving, but also a space where they felt cared for. One participant shared, "We do everything, but we don't have that breath that we've had here. I was able to sleep, to rest." Still, some participants expressed heightened emotions and guilt about leaving their child to attend the weekend retreat. For some, this was the longest time that they had been away from their child since their heart transplant. Participants described finding the courage to come and noting that retreat was a good excuse, given that it was meant to help them care for not only themselves, but for their child. One participant explained, "This was a very good excuse that could benefit everybody, not just me. It was a very good recharge." The second theme was on reflections, the value of learning mindfulness skills to build coping capacity. So in addition to the break from caregiving, participants recognized the need for effective coping strategies as a key reason for attending the retreat. For many, this was their first experience being immersed in mindfulness practice and approached it with curiosity and open mindfulness. As Joanna did mention, there was definitely some hesitation from some of the participants, but throughout the sessions, they were encouraged to explore their experiences in newer ways, with focused awareness of their emotions, perceptions, and values. One participant shared, "The awareness of your surroundings and to be grateful for the moment that you're in. These were great lessons." While participants may have been again initially hesitant to examine their past experiences, many appear to develop the courage to confront those emotions with self-compassion and forgiveness. One participant explained, "It was forcing me to deal with emotions and thoughts that I had never dealt with. It was a huge learning experience." Nevertheless, a few participants acknowledged struggling with the practices and needing a break to allow themselves time to reflect and gain insight into their thoughts. Ultimately, many participants described an overall shift in sense-making arising from the practices, including continued awareness of emotions, discarding automatic negative thoughts, and becoming compassionate witnesses to their own experiences. The third theme, relations, the importance of connecting and sharing stories with other mothers at the retreat. The opportunity to meet and engage with other mothers of heart transplant recipients was described as one of the most meaningful and unique experiences. As participants arrived on the first day, and Joanna had shared the photo with you, an instant connection was built upon shared lived experiences, which was quickly formed among mothers. Formal circle sharing and informed after-hour socials became healing spaces for participants as they were able to connect with one another uninterrupted. Storytelling and the ability to listen and understand other mothers' stories became cathartic and empowering and therapeutic for participants. For mothers earlier in their heart transplant journey, hearing the hurdles and perseverance from veteran mothers offered them increased hope for their child's future. One participant described, "To have these families and hear what their children have gone through and have gone to high school, it gives you such hope." In parallel, for mothers further along in their transplant journey, providing support and inspiration to newer heart transplant mothers offered a rewarding opportunity for mentorship. Overall, meeting other mothers at the retreat empowered participants to feel less alone in their transplant journey. This was heightened by one participant who shared, "You feel like you're not alone. You have people to reach out to. You have that source of support of someone who gets it." Oops. Overall, participants described their experience at the retreat as validating, relaxing, eye-opening, enlightening, educational, life-changing, and supportive. 3 months after the retreat, all participants shared that they had adopted at least some of the mindful teachings into their daily lives and described positive impacts of the retreat, not only for themselves, but also for their children and families. One participant shared, "I've used the mindful meditation when I find myself starting to go, and it's worked for me. where you just get yourself back in the moment to stop your thoughts from racing. It's given me more quality time with the kids. I think it gave me an overall sense to find time for myself. We also analyzed participants' questionnaire scores of mindfulness, coping skills, perceived social support, distress tolerance, and quality of life. All outcome measures demonstrated positive trends across the 3 time points, indicating improvements in these outcomes from before to after the retreat. Significant improvements were observed 3 months following the retreat regarding participants' ability to be mindful. So, for example, observing and being non-judgmental, coping through maintaining family integration, and perceived social support from family members. Overall, all participants were satisfied with the retreat and agreed that the retreat should be an intervention offered to all families. One participant explained, "It doesn't only help me as a mother, it helps the whole family because the whole family is impacted. And it would be great if it was offered on a yearly basis. I could look forward to seeing my tribe and we can share more stories and we can relax with each other and just come back home to our families, happier than how we left." Our findings support the retreat as a promising intervention that improves maternal coping, social support, and quality of life, underpinning family-centered care within pediatric transplantation. Research on mindfulness indicates that some qualities of resilience can be taught, which is what the retreat has demonstrated. The goal of the intervention was to equip mothers with positive coping skills that will allow them to cope more effectively themselves and to better support their children. This will result in improved patient health outcomes and lower healthcare utilization. Supporting mothers would maximize long-term benefits for their child's health, as well as efficiency in the broader healthcare system. Results will inform a template for expansion of the retreat to other clinical caregiving populations in solid organ transplantation and chronic illness programs. Further iterations of the retreat could be developed to include other family members, such as fathers who did express that they felt left out, siblings, as well as other extended caregivers. So we wanted to thank the many mothers who participated in the study. And we also want to thank our funders and supporters, as Lori mentioned at the beginning, our ongoing collaboration with the Canadian Donation and Transplant Research Program, and our funding through the Sick Kids Labatt Family Centre. So at this point in time, Joanna and I would welcome any questions or comments from the audience.
Terrific. Thank you so much, both of you, for a really wonderful overview of this unique, this unique, not an experiment exactly, but it is an experiment. And it's just so wonderful to watch how it came together and the comments and learning experiences of the various participants. We have a few questions in the chat that maybe I'll ask. One is from an anonymous attendee who says, how can the lessons learned in this 2-day retreat be applied in a hospital setting for those who can't get away? Samantha, maybe do you have some thoughts on that?
Sure. And then I'll also hand it over to Joanna because she actually participated in a lot of those sessions. I'm curious what she's been able to use in practice and within the hospital environment. So it was a great question. Thank you very much. We do actually offer at Sick Kids several different mindfulness sessions for families who are inpatient. One of the main ideas of the retreat was that all of the actual sessions, except for the deep relaxation one, were things that could be done in under 5 minutes. I think being very mindful of the fact that moms, as all caregivers, are incredibly busy. So it's not, realistic to think that you're going to lay down for an hour and meditate in the middle of your day. So things that you could do, pardon me?
In the hospital.
In the hospital, yes, with your yoga mat. So very mindful of, again, being present in the moment, shifting kind of that judgmental thought to more positive thinking and different coping skills. So things you can do in under a minute, even placing your feet flat on the ground, shutting your eyes and taking a deep breath, which maybe you're doing, just before or after the medical team's coming in to interact with you for a consultation, and even teaching your child some of these skills. So we do a lot of mindfulness training with patients at Sick Kids. So whether or not they're anxious about a procedure or even communicating with other staff members.
Thank you.
Joanna, I'll ask you from your perspective.
Yeah.
What you have felt from. Sorry, Lori.
Even the activity I mentioned during the eating. So, even in the hospital, we have to stop and eat. And just taking those few minutes, like putting your phone down and focusing on your food and just bringing your mind to the present moment. These are just small skills that you can learn to implement throughout your day that just give you those few minutes of mindfulness to calm your mind for a few moments. So there's lots of transferable things that can be used no matter where you are.
That's great. Thank you. We have another question. What resources exist for mothers and other caregivers of pediatric transplant patients?
That's a great question. I feel like we planted that one because Joanna and I are thrilled to share that we have actually recently received several different funding, some grants and awards, including from the CDTRP, the Kidney Foundation of Canada, and one of our national funders, the Canadian Institutes of Health Research, to actually pilot an iParent-to-Parent peer mentorship program across the solid organ transplant population. So again, many of our families geographically live in quite remote regions throughout Canada, and it's often very difficult to actually implement psychosocial interventions for families. So this will be a virtual support group that will be setting up, where again, we'll have trained mentors supporting some of the mentees. So really excited to hear about to launch this pilot as an additional kind of support mechanism for families. Right now we have informal where families often, when they're deciding about pursuing transplant as a treatment option, that they might ask to meet another family. So we often do that, but it doesn't provide the kind of ongoing support that families talk about throughout the various transitions throughout both their and their child's life. So different kind of developmental transitions, not only from pediatric to adult care, but when you're going from an infant to a toddler, child, and adolescent, lots of very unique and fun challenges that we face as parents. Joanna, do you also want to comment on some supports?
Well, I think really, it's great to see the progress, because Samantha and I have been talking about these types of things for 17 years now. And that was one of the things that, we would discuss early in my daughter's transplant journey, is the lack of supports for parents. So to see these programs, and, even this month, I've had different mothers coming to me, are we doing the retreat again? I want to do the retreat again. So, things like this retreat, things like the iParent-to-Parent are some great progress from where we were early in our transplant journey to getting to that support in a more formalized way.
Well, one of the
programs, sorry, Lori, there's often social workers and psychologists and psychiatrists and nurse practitioners, but we often provide a different type of support. So I think what really came out of this retreat is that, yes, we are there in a supportive capacity, but we haven't lived similar lives, most of us. So the support that you're able to get from a peer who, again, can share similar stories and experiences just really enhances that kind of network of support. Sorry, Lori.
No, that's okay. And I'm sure it, as you've pointed out, decreases the social isolation that people may feel when they don't have those connections. One of the questions in the chat is, are there plans to have another retreat? And also maybe you could both comment on, what do you plan to do with fathers and other caregivers, such as grandparents? And where are there some opportunities there?
It's great. We actually have gone back to the foundation. It's often very difficult to actually obtain funding for these type of kind of pilot psychosocial interventions, which is one of the huge benefits of the Canadian Donation and Transplantation Research Program. This is the type of research they often fund, really impact on kind of patient partners and family and caregiver support. So we are hoping to be able to offer it again. Again, now that we're talking about evidence-informed practice, we have evidence that has shown that it has made a difference. So we are hoping to use that to advocate for, again, additional funds to be able to offer this again, not only to mothers, but as you mentioned, fathers. And I think being very mindful that we'd want to adapt the program to specific needs for fathers. Grandparents are a huge, group of caregivers that often get forgotten and play a critical role in caregiving. So mindful of that, as well as siblings. So I think there's a huge opportunity to expand this program. Also, this was limited to Ontario. So we'd love to be able to do this on a national basis. So I'm looking at Lori because this is a great, collaborative partnership we can have with CDTRP moving forward. Joanna?
I think you pretty much covered it there. I mean, along with the fathers, I did come home and talk to my husband, and we kind of discussed, the retreat would maybe look a little different for dads than the moms. Maybe they would, bond over golfing or something like that. So, yes, exactly. But I mean, regardless, you can go to Huntsville. It's a beautiful, relaxing place. So, definitely lots of places that we can take this program.
And it would be a great opportunity for fundraising initiatives when families are donating funds to direct it towards some of these psychosocial interventions to support families.
Yeah, good ideas. There's also a nice comment in the chat that I'll read out for you. This is to everyone from Ansara Pibenga. I hope I've said your name wrong, Ansara. Great to hear about your new parent-to-parent support group resources. Hooray, she says. Transplant Families also offers a weekly Caregiver Connect support group with a licensed social worker every Tuesday at 8 p.m. Eastern. Register here, and you can all find that in the chat. Would you like to say anything about that, Ansara? Please go ahead. You're muted. I'm not sure if I see your picture there, but you are muted.
I'm sorry. Hi.
Hi.
This is a great, wonderful presentation. Thank you so much. And we really appreciate you doing this. And this is also something that we find is very important, having caregivers have an ability to talk to one another. So that's why we have the Tuesday Caregiver Connect program. And we found it's a great opportunity for people across organ donation, different heart, kidney, liver, transplant recipient caregivers are able to talk to one another, and similar to your retreat. So we applaud what you're doing as well. And just would love to have people tune in as well to our Tuesday program as well. Thank you.
Thanks for making that information available to us. I know that the Transplant Families organization is itself just a wonderful example of how to connect and meet the needs of our families who are involved in transplantation at every level. So I'd applaud Joseph and the others who have come together to do such important work here. So thank you, Ansara, for sharing that. And thank you, Joseph, as well. Samantha and Joanna, do you have any final comments?
No, I think, thank you very much for attending today's session. Thank you very much for the positive feedback and encouragement. Lori, thank you for the introduction. And Joanna, always a pleasure to work together and to present.
Well, and also, could I just say, I think this is also important for international, this is because we work together in different ways now, and being able to connect families internationally as well as across Canada and the US there's some great opportunities there too. So thanks to all our participants, and thanks to the organizers, and have a wonderful evening.